Welcome to UMCC Medical Consultant Connectors, where your health matters to us. Ever wondered why some people seem to be constantly on their toes, losing weight rapidly, or feeling unusually anxious? Could it be hyperthyroidism, one might ask? This condition occurs when an overactive thyroid gland produces an excessive amount of thyroid hormones. But why does this matter? Well, let's take a step back and think about the role of thyroid hormones. These hormones have a significant impact on our body, controlling metabolic processes, body temperature, and even heart rate. They're like the silent conductors of our bodily orchestra, ensuring all parts play in harmony. When you have hyperthyroidism, this harmony can be disrupted, leading to a symphony of symptoms. Imagine the body as a car. Thyroid hormones are like the accelerator, and with hyperthyroidism, it's as if the pedal is stuck on full throttle. Hyperthyroidism, then, can disrupt these fundamental body functions. But what exactly causes this condition? So, what triggers the thyroid to go into overdrive? Well, there are several causes of hyperthyroidism. One of the most common is Graves' disease. This is an autoimmune disorder where the body's immune system mistakenly attacks the thyroid gland, causing it to produce an excess of thyroid hormones. Another cause is thyroiditis, an inflammation of the thyroid gland. This can result in stored thyroid hormones leaking out into the bloodstream. Excessive iodine, a key ingredient in thyroid hormone production, can also trigger hyperthyroidism. This might happen if you consume large amounts of iodine, either through your diet or from medications. Lastly, tumors in the ovaries or testes can cause hyperthyroidism too. These tumors can produce a hormone similar to the thyroid-stimulating hormone, which can lead to overproduction of thyroid hormones. These causes can lead to some noticeable effects on the body. Let's delve into what these effects or symptoms can look like. How does one know if they have hyperthyroidism? What signs should you be looking out for? Hyperthyroidism can present itself in many ways, and the symptoms can often be mistaken for other health conditions. It's like a chameleon, blending into the background until you really start to pay attention. One of the most common signs is a rapid heart rate. It can feel like your heart is trying to win a marathon without your consent. This could be accompanied by unexpected weight loss, even when your diet stays the same. Imagine losing weight without trying. It might sound ideal, but it can be a sign that something's not right. You might also experience heightened anxiety, irritability, or find yourself feeling hot when others are comfortable. These symptoms can be subtle, like whispers in the wind, easy to miss if you're not paying attention. Tremors, particularly in the hands, can be another telltale sign. It's as though your body is vibrating on a frequency that it shouldn't be. Knowing these signs is the first step towards diagnosis and treatment. So, how do doctors diagnose hyperthyroidism? If you're suspecting hyperthyroidism, how can you confirm it? What tests are involved? Well, let's dive into that. To diagnose hyperthyroidism, doctors often use a combination of tests and physical examinations. A common starting point is a blood test to measure levels of thyroid hormones in your body. Increased levels of the thyroid hormones thyroxine, T4, and triiodothyronine, T3, often indicate hyperthyroidism. Now let's talk about the thyroid scan. This test involves ingesting a small amount of radioactive iodine and then using a special camera to visualize your thyroid gland. This allows doctors to assess the size, shape, and activity of your thyroid, providing valuable information about its health. Physical examinations also play a crucial role. Doctors may check for tremors, an increased heart rate, or an enlarged thyroid gland. Early diagnosis is key for effective treatment. It's important to consult with your doctor if you suspect you may have hyperthyroidism. Once diagnosed, what are the treatment and prevention options available? Knowing you have hyperthyroidism can be daunting, but it's a condition that can be managed effectively. There are several common treatment methods available, each tailored to the individual's condition and lifestyle. Medication is often the first line of defense, with drugs designed to slow down the overactive thyroid. Radioactive iodine therapy is another viable option, which works by shrinking the thyroid gland and reducing its hormone production. In more severe cases, surgery may be necessary to remove part or all of the thyroid gland. In addition to these treatments, lifestyle changes can play an important role in managing symptoms and preventing complications. Eating a balanced diet, getting regular exercise and adequate sleep, and reducing stress levels can all contribute to better health. Remember, Regular checkups and following your doctor's treatment plan is key to living a normal and healthy life with hyperthyroidism. Hyperthyroidism, while a serious condition, is treatable and manageable with the right knowledge and care. UMCCC, your ultimate consultant connector.